Mary Geckler spent most of her adult life working in her family's business while also taking care of the house and kids. During a routine doctor's appointment, she noticed the words in the book she was reading became blurred. The next thing she knew, she was being loaded into the back of an ambulance, having suffered a stroke.
Next thing, I said, I feel funny again. And with that, it all came back. And it was just there. I don't remember thinking anything except that it was over. But it wasn't. It was the beginning, I think.
A stroke changes not only the life of a patient, but the lives of the people around them as well. The recovery process varies per patient. With effective care at an experienced rehab hospital, many patients move down the road to recovery as quickly as possible. Over the next few minutes, we're going to tell you how strokes occur and the 3 types of strokes. What happens once a stroke survivor arrives at an acute care hospital? What happens when a stroke survivor moves from an acute care hospital to a rehab hospital? The types of therapy available for people who have had a stroke. What to expect when the patient returns home. Spasticity, what it is and how it's treated. And finally, what can be done to help stroke survivors regain a normal sense of being once they return home. A stroke occurs when blood flow to the brain is limited. This lowers the amount of oxygen the brain receives from the blood supply. There are often warning signs a person is about to suffer a stroke. They may include a sudden onset of some of these symptoms: numbness or weakness in the face, arm, or leg, especially on one side of the body; confusion, trouble speaking or understanding others; trouble seeing in one or both eyes; trouble walking; dizziness, a loss of balance or coordination; and finally, a severe headache with no known cause. There are 3 types of strokes. The first is a thrombolytic stroke, also called a cerebral thrombosis. This occurs when a clot that forms inside the cerebral artery blocks blood flow to the brain. This is the most common type of stroke. An embolic stroke happens when blood flow to the brain is blocked by a clot that originates somewhere other than the brain, like the heart. A piece of the clot, called an embolus, breaks loose and is carried by blood flow to the brain. The final type of stroke is hemorrhagic. This happens when a cerebral blood vessel breaks, spilling blood into the brain tissue or the area surrounding the brain. Once a stroke patient arrives at the hospital and is stabilized, doctors will try to determine what type of stroke occurred, the cause of the stroke, and which area of the brain was affected. Typically, a CT scan or MRI will give physicians the answers to these questions. After a hospital stay, patients move to a facility like Southern Indiana Rehab Hospital, where the primary goal is to return the patient to a functional life. They may need to stay at a facility like this for up to 3 weeks, with outpatient rehab services available upon discharge. Rehab is where skilled medical professionals work to help stroke survivors gain as much independence as possible. This may mean patients have to relearn how to perform daily tasks we often take for granted. Another important part of the rehab process for the patient is the specialty of rehab nursing. The rehab nurses assist with managing any medical needs the patient may have. There are typically 3 types of therapies a stroke patient will receive while at the rehab facility. They are physical therapy, also called PT. This helps patients restore physical movements like walking, stair climbing, balance training, wheelchair mobility, muscle strengthening, and much more. Occupational therapy, also called OT, involves relearning skills needed for everyday living. These include eating, dressing, bathing, grooming, and other abilities so patients can take care of themselves as much as possible. Speech therapy helps patients recover swallowing and communication skills. Some patients experience paralysis of the muscles that allow them to swallow, making eating and drinking unsafe. Sometimes stroke survivors have difficulty finding the correct words to express their needs or difficulty understanding what others are saying. There are also many other professionals such as psychologists, case managers, dietitians, and therapeutic recreation specialists who assist in a person's recovery from a stroke. About 10% of patients have sustained so much injury to the brain from their stroke that rehab may not significantly improve their overall condition. These patients may require placement in a skilled nursing facility. For most, therapy will continue on an outpatient basis in a setting such as the day hospital at Southern Indiana Rehab. Patients will receive the same intense level of therapies as an inpatient, but will be allowed to return home in the evening. Prior to a stroke survivor returning home, there are several precautions you should take. Remove or rearrange furniture that interferes in getting from place to place. Clear pathways that a wheelchair or walker can move through comfortably. Remove all throw rugs and tack down any loose carpets. And also, secure telephone and electrical cords so the patient isn't likely to trip over them. If stairs are in the home, consider setting up the patient's bedroom on the first floor of your home. Since bathrooms often have the narrowest doorways, you may need to get a bedside commode for patient use. Oftentimes, a tub seat or bench is recommended for showering or bathing. You may also want to consider adding grab bars to the tub walls. A portable phone is often best for the patient, but if one is not available, choose one with an oversized dialing pad with a speed dialer. Make sure emergency phone numbers are posted by every telephone. While dressing can prove to be a challenge for the stroke survivor, it's important for them to be able to dress themselves as much as possible. This helps the patient regain a good self-image. Some things to remember. Get clothing that is easy to get on and fasten. Consider pants with elastic waistbands, pullover shirts, and use Velcro for closures. A condition that affects many survivors is spasticity. It usually strikes the arms and legs and is characterized by the inability to stretch the muscles. Spasticity occurs when the muscles become too tight, leading to the inability to adequately move the arm or leg that is affected. It's vital to help stroke survivors perform activities they enjoyed prior to their stroke. Therapeutic recreation specialists help patients adapt leisure activity to meet their needs. Southern Indiana Rehab Hospital helps stroke survivors return to as normal a life as possible by providing a number of activities. Our stroke support group gets together each month and is for both stroke survivors and their family members and caregivers. Southern Indiana Rehab's Stroke Camp is a chance for stroke survivors to spend a weekend with others who've had similar experiences. Just like most camps, participants enjoy hay rides, arts and crafts, fishing, and much more. So finally, let's recap. A stroke occurs when blood flow to the brain is restricted. There are three types of strokes: thrombolytic, embolic, and hemorrhagic. A CT scan or MRI will help physicians identify the location of the stroke. Patients who are able to go to a rehab hospital may stay at this facility for up to 3 weeks. There are three primary types of therapy stroke survivors receive: physical, occupational, and speech. Patients who are able to return home often must continue their rehab in a setting like Southern Indiana Rehab's day hospital or outpatient program. Adjustments may need to be made to the patient's home to keep them safe and help stroke survivors regain a sense of normalcy as quickly as possible by adapting routines they enjoyed prior to their stroke. As for Mary, she's now well on her way to recovery, and her bowling game is almost back to where it was prior to her stroke. While her recovery has been difficult at times, she continues to fight and has gained a new perspective on life in the process.
I'm not like I was before, I don't think, but I think I'm close to it. I have a different way of looking at things than I did then.